Hello and welcome to our presentation, Virtual Care from 0 to 60 in Warp Speed. Now what? My name is Bob Schwinn and I'm a senior partner and co-lead of the Informatics and Technology practice at the Chartis Group. I'm disappointed that we won't be able to be there all together in person, and I look forward to the craziness of our world coming to an end soon, and we can get back to somewhat maybe a new normal that brings us all back together for these conferences. I'm delighted for this session to have a good friend, colleague, and partner with me that's going to share some perspectives and some exciting work from his organization. Charles, would you mind introducing yourself?
I'm the CIO at Franciscan Alliance, been with the organization for 2.5 years now. Looking forward to sharing with you our journey during this pandemic and the work leading up to it that allowed us to respond very quickly to meet the needs of our patients.
Great, thanks, Charles. So over the next 30 minutes, I want to just frame the discussion that we want to share with you and outline some of the learning objectives. We want to really walk through kind of what we've seen happen over the last couple of years, and particularly with the pandemic, kind of the role of virtual care and where it's at, where it's headed, and some perspectives on how the industry and some industry leaders are taking to really move the needle and advance their digital initiatives forward in this regard. Also, I want to share some prioritization frameworks that we found helpful in terms of really laying out that roadmap and really prioritizing where does one start, how does one focus on things that are most accretive to your business and your strategies. We'll share some of the perspectives that we've found in organizations where they've looked at, they've really had a good discipline around measuring and targeting performance and how important that is for a feedback mechanism to monitor your progression, the performance, the experience across the continuum of the virtual care and your digital strategy. And last, we want to just talk about some of the challenges that the industries face with building and sustaining virtual care despite some of the factors that we're dealing with from a pandemic, and how maybe you can overcome some of those from the tips and lessons learned that we'd like to share today. So we've broken this up into 3 sections, an industry point of view that I'll share some perspectives on what we believe and see as leading organizations are doing to really advance and move their capabilities further. Charles with Franciscan Alliance has done some amazing work. They were well down the journey building a strong foundation, so well prepared for this pandemic, and have some exciting plans and aspirations for the future to continue that journey. And we'll wrap up with some quick tips and areas of focus for you to take back to your organizations. So when we think about from a kind of an industry perspective and what we've dealt with, we've all been really focused on this pandemic over the last number of months, and like many of you, there's been a ton of work that you've put into this in terms of really reacting to and positioning your organization to not necessarily push adoption, but out of necessity, really deal with the challenge of seeing and continuing the continuity of patient care. And so I know, in fact, almost every conversation I've had with my CIO colleagues and peers has been just a wonderful story of heroics and pulling out all the stops to address the technology, the workflow, the processes, and all the change that you had to do almost overnight. And almost all of you, I'm sure, have an incredible story of how you were able to move your organization. And so in between March and April, we had an amazing surge. We went from almost kind of 1% of overall provider visits across the country to well over 50%. That was a 3,300% increase in the use of this virtual care or telehealth, however you may label it. But unfortunately, what's happened over the last number of months, as the pandemic has maybe become more of a way of life, and we've stabilized a bit and we've moved back to in-person, and organizations have really shifted, and we've seen a pretty significant plunge in what what was and what we thought was going to be a catalyst in keeping us and pushing us further into this digital arena has not quite worked out the way that most of us have thought. So real questions still remain, in terms of how do I stabilize and sustain and deliver the care, and how do I do that with one of the biggest challenges is managing both physical in-person visits with virtual visits, and how do I create capabilities and the connections and the uniformity in my organization to do that in an effective way has been really challenging. Also, organizations that we found that really tend to be leaders and out in front tend to not just be looking at virtual care as a driver or a necessity to address some of the pandemic, but many of them are looking at that in terms of the mounting and changing consumer demand. How do I address that? Many are looking at it as the competitive disruption that's happening in their marketplace, looking at it as a competitive advantage. Do I have an opportunity to be a first mover? Can I move the needle in my marketplace that maybe drives more loyalty, helps grow patient volumes, and improves access across my market? And in some cases, many organizations are looking at the cost pressures and the economic conditions of their organization and seeing that there are cost-effective ways of offering virtual care to help free up premium caregiver capacity and deliver effective care in a lower cost scenario, thus driving improved margin. Organizations that also do this well struggle with, what do I need to measure? How do I measure the impact? Am I moving the needle? And having that cycle of continuous improvement is very critical to helping manage and monitor the progression of your virtual care from a programmatic perspective. And then last, struggling with organizations tell me this a lot, that they're struggling with the capabilities. I've got the technology platform, but what else do I need? How do I make sure that I'm continuing to drive and support and encourage adoption? How do I measure value and making sure that we're not just taking a scattergun approach, but rather we're focusing on those things that are going to be most accretive and most aligned with our strategic imperatives? And how do we make sure that this is sustainable and workable for both our providers, our caregivers, as well as the consumers and patients who have a need for a connected and a high-level experience? So let's take a look at the plunge, if you will. Not sure there's a better word for it, but as you go back to that graph, there's been a kind of a drop, a significant drop, and we've seen this in almost every area of the industry, every area of the market. Almost every organization has experienced that. And we've been able to categorize this into 6 different areas that organizations are experiencing because of the challenges that they have or this environment creates. One is the care model and the clinical delivery. And organizations, I think, that were ahead of the curve tended to think more about the care model, the care delivery experience, creating a connected and the continuity between both an in-person visit as well as a virtual visit. And how do I commingle those so that if a physician or a care provider is going from one point in their office of seeing a person in real time and then going to a virtual environment and seeing a person, how do I juggle that? And how do I do all the other administrative things associated with it? And likewise, on the other side of the equation, what's the experience of the consumer that may have a chronic condition or see multiple caregivers? How do we connect that and move that together? Caregiver capacity is a challenging one. There's incentive models that, traditionally RVUs and promote, really throughput of patients and the number of patients. And sometimes that kind of flies in the face of the incentives around virtual care. How do we change that model? And how do we potentially leverage other practitioners at lower levels to get them to practice at their highest potential license capability and maybe offset and free up premium physician capacity? The workflows, really transitions of care, all the things around the care delivery journey, if you will, tend to be fragmented, and patients and consumers are experiencing that and getting frustrated with that, and even physicians and providers are experiencing that. So there's a tendency to go back to what was known, what was comfortable. The economic factors continue to be a real challenge in terms of the reimbursement and some of those issues, but many organizations have figured out very tactical and real ways to change the care model to be much more effective, efficient in driving that volume and doing it in a cost-effective way. Even though reimbursement may be lower, they're able to do that in a cost-effective way that allows them to maximize and in some cases improve their margin around those services. Like many of you, I've talked to lots of CIOs who tell the story and ended up kind of at current times with the pandemic of describing a rapid acceleration of a portfolio of tools, a number of platforms and solutions to enable virtual care. We all know that that's not likely sustainable from a long-term perspective, and there's an opportunity to really harmonize the portfolio that we've got to make sure that it's cost-effective, easily maintained, well integrated, and certainly can scale as we go to the future. And probably most important, we have changing behaviors from our consumers and patients. They're getting much more savvy about their virtual experiences, and many want more and more and demand higher levels and a better connected experience. So those are areas of focus that we would urge that you use as a framework to guide the development of your roadmap and your acceleration of your virtual care programs. We've seen some organizations, many organizations that tend to have a very effective program tend to not just look at the episodic view of healthcare, but really looking at the continuum of care. So all of the areas where a consumer or patient may seek advice, guidance, research, care, post-care, whatever those areas are, and really how do we connect and create an experience that focuses around the continuum. And some organizations are coming out very clearly, both before the pandemic and during, and declaring that virtual is really the way of the future, not just a necessity for the pandemic, and really declaring that virtual first in many cases is going to be our ongoing strategy. And so really using a model like this to help understand the journey and the opportunities you have, and particularly where does it make sense for an organization to either start or add on to capabilities in the virtual journey to really move the digital needle forward in their efforts. So organizations that really are taking a programmatic approach tend to look at 4 areas to really help frame the way they think about and bucketize the work, and in some cases to lay out a programmatic program plan, a project plan for how am I going to execute on this. And it tends to fall into 4 different areas of focus. One is around the clinical service model. How do we really orient our care providers to really be connected with patients, and what's along that journey that we described, what are the pieces that are going to make us make the experience good and effective for our consumers and our patients, and from our providers as well. And what are all the things that go into that in terms of the engagement of patients, the workflow, all the connections. The second one is the operating model. Very important to have an organizational structure that has good governance and engagement and a leadership support, really good project management, all the human capital things that go into all the compensation and incentives that need to be put in place, and some of the performance monitoring and management, so that these oftentimes take ongoing and sizable investments. And how are you working with your executives to do that? The funding model is really important. Organizations that we've seen that do this well have a very disciplined and rigorous approach to projecting, building pro formas, really financially looking at the capabilities that they're going to want to invest in, and helping it to prioritize where they spend their efforts. And last is the technology architecture and all the traditional things that we go into it, but it's really new, right? It's how do I build analytics from a consumer perspective? What are the capabilities I need to build my digital front door and make a better connected experience, and all the things that go along with that. So in summary, there are 5 key things that I will leave you with. One is areas of focus should be build a sustainable model by understanding what that future state is, where the economic opportunities are, where those investments and those connections around the consumer and patient continuum, where it makes sense for us to start, what are the value propositions, the accretive value that's going to be most helpful, because that'll help lay out the roadmap. Leadership is important. My belief is that CIOs have a real opportunity to lean into this and really lead, guide, and provide influence and vision for their organization. And many of you are, and I think there's an opportunity to continue to do that as we see the emergence of, chief digital officers and other roles coming into play. CIOs have a real opportunity to continue to drive that. The platform is key. Figure out how to sustain and build this is something that all of us, all of you know how to do really well, build a sustainable platform. Another key competency that we're seeing organizations invest in is change leadership. How do I help really manage and influence, persuade the organization and my leadership to a new level? It takes a discipline around that. And organizations that are doing this well tend to have invested heavily and have a mature capability. And last, just pay attention to the consumer's experience. I can't, from a Chartis perspective, we've seen a lot of change over the last couple of years in the consumer preferences, what they're expecting, their savviness, and being able to monitor that and get real-time feedback about how you're doing, what's of value, and how to continue to move the needle will be most important. So with that, I want to turn it over to my friend Charles Wagner, who has some exciting kind of story around their journey, both pre, during, and now looking into the future of this pandemic. Charles?
Thanks, Bob. I appreciate that. Let me start off with sharing a little bit about Franciscan. We're one of the largest Catholic healthcare organizations in the Midwest, made up of 12 hospitals, over 20,000 employees, serving our patients and their families from central Indiana to south suburban Chicago. We have over 2.2 million outpatient visits, nearly 400,000 ED visits, and over 14 million lab draws per year. Our Franciscan employed physician network is made up of over 750 providers. We have 15 urgent care sites, in addition to our retail and ambulatory clinics. As I came on board Franciscan about 2.5 years ago, it was evident that Franciscan needed to learn to crawl before we could walk as it relates to our virtual journey. And then COVID hit and we literally had to sprint. We started our virtual care journey several years ago, initially focused on solutions in our acute setting. And over the past 2 years, we've expanded those services in our virtual care tools in our ambulatory settings. We hired operational leaders who became accountable for our virtual care. We expanded our physician and patient education and workflow design and marketing to grow our offerings. And then, like many, COVID hit. The good thing is we were positioned very well based on all the work we had done to respond to COVID. We now have our platform in place, our governance model in place, of which Bob talked about is key to success. And we are actively monitoring our performance and taking the feedback that we're getting from not only our patients, but our care teams, and continue to refine what we thought was a well thought through virtual care model and workflow. And then again, when you hit the volumes of the pandemic, all things are kind of reveal themselves. So as we looked to, if I step back and I think about where we started this journey, we took a very methodical approach to defining what our virtual care strategy and roadmap needed to look like. We put a framework in place that talked about delivery of care and the access points, and looked across the top, as you see on the screen, talking about what are the strategic importances around attracting new patient or the patient experience Bob highlighted. And we went through a process of bringing a well-diverse functional team, clinical team, business owners together, and went through and prioritized those functions and those strategies that would provide the most value for our patient, have the highest impact on the care and outcomes we were looking for, and narrowed that field of having over 100 plus areas we could focus on to very focused. Looks like we ended up with about 6 key strategic focus areas that we lasered in on as we began our approach and took this virtual care strategy system-wide. The result of that work, you see before you, started off, it laid out a roadmap for what it looks like starting in 2018 and going beyond into 2021 and 2022. As we started our journey early in 2018, we looked for some quick wins. In this case, we looked at telepsych, telestroke. We enhanced our remote patient monitoring. We put a digital innovation and governance body in place. And with those quick wins, it enabled us to continue getting the investment and the buy-in that we needed to continue to drive those strategic imperatives as we began to expand that system-wide approach to the virtual platform. Had we not taken the time to put the governance process in place, to put the leadership in place, to put the underlying platform in place, we would not have been able to respond the way we did when the pandemic hit. And in order for us to be able to serve not only our patients, but protect our caregivers in this crisis. And it really highlighted the role that IT plays in delivering a strategic value to the organization, and especially in this time of unprecedented demand and speed at which we need to respond from a virtual point of view. Again, IT has an opportunity to really shine here as a business partner to deliver that. We took a thoughtful and proactive approach to assessing how we were doing, and we're continuing to build on momentum. We've come down on the other side of the curve, as Bob pointed out. But as we go into our future and we look at the lessons learned, one of the key things that we are focusing on is our success measures. How are we going to determine whether we're on track or not? So one way that we're doing that is we focus on performance metrics. And some of the examples of those metrics are displayed here. We've got in one area on our acute care side of things, we're looking at percentage of adoption to our patient portal. Bob talked about how important it is to really focus on that patient experience and their ability to get access to our care teams when they need it, and to navigate our system is key. And our patient portal is one of those entry points for us, and one of the, again, metrics that we use to monitor. Another area in the ambulatory setting, we're looking at the new volume brought to Franciscan quarter over quarter. Again, as we continue to have more and more millennials and whatever the next generation come in, they want to have the ability to be taken care of on this device. And having a mobile strategy, a virtual care strategy that's easy for them to become part of our system. And again, one way that we're monitoring how successful our platform strategy is how many net new patients are we bringing. On the post-acute side, we're really looking at two areas in addition to those listed here. One is the total number of remote patient monitoring devices that we deploy per quarter. And I'll talk a little bit more about why that's important, but that really helps us understand and gives us the ability to monitor a patient's health and meet their needs where they're at by having those connected devices in their homes, connected into our care team. In addition, we're looking at ED utilization and the cost avoidance around there. If we're doing a great job in our post-acute settings and our home health division and our primary care teams, then we can avoid the cost of having folks come into the ED utilizing those higher cost entry points into our organization. Bob talked about a virtual first strategy, and that's key to our success and what we believe our ability to deliver better care and a more affordable cost as we look towards the future. So if we step back for a second, which we often do, let me come back here. Sorry, I got out of sync there. If we step back for a second, we look at how we've done to date. And so through October, if we look at our kind of virtual care by the numbers, we have gone from 6 sites that were set up with virtual capabilities to having deployed over 300 of our sites in a matter of weeks. We have, at our peak, Franciscan hit 61% of our patient visits were done in a telehealth virtual fashion, which is well above both the local and our national average. Between April and October, we completed over 118,000 video visits. It's ironic, as we began our virtual journey early in the year, we were looking at projections that have maybe 1,000 video visits a month. And we quickly ran to a point where we were heading 8,000 video visits a week. And as many of you know, and we could talk about the ramifications of that, most of the vendors, one thing that we learned, most of the vendors across the healthcare industry were not able to handle that volume. Both the volume, the number of patients, number of sessions, all required us to go and look for alternatives. So we had to be very nimble, and now we're working on, evaluating what needs to be done to continue to streamline and to take those lessons learned. Today, 1 in 7 visits, 14% of all of our visits are video, and still above the national average. But we're working to understand how do we continue through a virtual first strategy to bring those volume numbers back up, because again, the responsiveness, it's more cost effective, more patient satisfied. If I don't have to get in a car, take my sick kid to the doc every time they have the sniffles, that I could do that through a video visit. It is much more patient centric, and from a physician point of view, a lot safer, especially in this time of a pandemic. So truly, what's next and top of mind for us as we look towards the future, we're focusing on kind of 3 critical success factors. 1, experience. 2, care delivery. And 3, revenue. On the experience side, we're really focusing on how will we deliver that seamless patient and caregiver experience. We've spun off a task force that, from an IT point of view, I've been asked by the CEO to chair, to say, how can we continue to take all the lessons learned from an operations point of view, a technology point of view, and continue to drive that, enhance that experience for both our patient and physicians. A lot of work to be done there, a lot of opportunities and lessons learned. Around the care delivery side of things, how can we provide the best care for the best outcomes? And we're excited. During this pandemic, we put in place care pods, and these care pods were a multidisciplinary team. They had, for the hospital-based, we had cardiologists and pulmonologists and the hospitalists, all rounding virtually on patients that were on our ICUs or in our hospital systems, and they were able to quickly refine care plans and allow patients to have a better stay, a better outcomes, and shorter length of stay. And we did that through a virtual platform. We set up 3 locations across our regions. And again, the outcomes are phenomenal. We're taking that same model and we're putting that into our primary care, surrounding them with virtual nutritionists, health coaches, behavioralists, and again, through that virtual platform, allowing us to have a more comprehensive care plan that we believe will have a huge impact on our patient experience and the outcomes. In addition, finally, we're looking at on the revenue side of things. Again, that virtual first strategy is key to long-term success, we believe, because it is a more streamlined, cost-effective manner of delivering our services. We're hyper-focused on getting every dollar we can out of our IT investments and utilizing that footprint standardized across the organization. And let me leave you with this. Bob mentioned this early on when I took in his presentation, but when I took this job as the CIO 2.5 years ago with Franciscan, during my interview process, I had a conversation with the CEO and said, listen, if you're looking for an IT guy and not a business partner that's going to be sitting at the table with you, working through strategies, driving strategies, then I'm not your guy. I want to be there. I want IT to be that strategic business partner, that thought leader to help us solve the problems that we have ahead of us. And this opportunity, the work that we have done leading up to pandemic and the work that we are continuing to do has demonstrated to our organization, and I believe it can demonstrate for all of you in your organizations, how valuable the role that the CIO and that team can play in leading the charge to transforming healthcare, especially in this time of crisis. So, Bob, I'll leave you with that. I'll turn it back over to you for closing statements.
Great, Charles. Thanks so much. I know we're running to the end of our 30 minutes, so I'm going to do a quick recap. Taking into account what you heard from some of the industry perspectives that I shared and just the great story of Franciscan's journey along this process. I hope there's some real takeaways that you can take back, and we'll just leave you with a summary of those here on this slide. Careful consideration around these different dimensions and a planful and programmatic approach is going to be key. I think all of us are energized about the not so much the pandemic, but the opportunities to continue to pull on different levers to move our digital and virtual initiatives forward are really opportunities that we don't want to miss. So wish you all the best in terms of continuing to lead and move your organizations forward. And again, look forward to seeing you all in a day sometime in the future. Have a great day, everybody.